I'm Director of Advocacy and Education at NAMI Delaware, and I have the pleasure of introducing Dr. Meghan Walls today. But first, we want to remind you that you're not alone. This is a difficult time, and what we talk about today might generate some strong feelings that you don't expect. So we want to make sure that you have access to crisis support should you need it. And the crisis support is available 24/7, no matter where you are. You can text the National Crisis Text Line. Just text DE to 741-741. Or here in Delaware, we have the Delaware Hope Line. You can reach them by phone by calling 1-833-9-HOPE-DE, or you can text them. Text DE Hope to 55753. Now, Dr. Meghan Walls is a pediatric psychologist in the Division of Behavioral Health at Nemours AI DuPont Hospital for Children. She holds an appointment as Clinical Assistant Professor of Pediatrics with Sydney Kimmel Medical College at Thomas Jefferson University. She completed her doctoral degree in clinical psychology at LaSalle University, her residency at Nationwide Children's Hospital, and fellowship at Nemours AI DuPont Hospital for Children. She provides services at Nemours DuPont Pediatrics in Wilmington, where she believes a focus on social determinants of health, understanding toxic stress, and positive parenting are important pieces of treating youth and families. Dr. Walls also serves as legislative and policy advisor within external affairs at Nemours, where she advocates for policies that benefit children by making healthcare more accessible, especially for vulnerable populations. In 2019, Dr. Walls was selected for the Nemours Physician Excellence in Community Service Award, as well as the award for 2019 NAMI Delaware Healthcare Professional of the Year. She holds an appointment to the Board of Directors of the Society of Pediatric Psychology and is the State Advocacy Chair for the Executive Council of the Delaware Psychological Association. Dr. Walls co-chairs the Data and Policy Committee for the Lieutenant Governor's Behavioral Health Consortium, and she is also involved in a number of other mental health efforts in the first state. Welcome, Dr. Walls.
Thanks, Annie. I appreciate that. I'm super excited to be here. NAMI Delaware and the staff of NAMI Delaware are good friends of mine. I am always thankful to have a chance to speak to everybody who comes to the NAMI conference, a little different this year. But nonetheless, really excited to be here. Amanda, do you want to pull up my slides? Maybe?
Yep, we're working on that now.
Awesome, thank you. I mean, I could just talk too, but you know. I see a white screen.
Do you see it now?
I still just see a white screen. I don't know what other folks see.
I'm going to stop sharing and try to re-share to make sure. Sorry about this.
No, you're fine. And if needed, I can try to share also. I do have my slides. Oh, there we go. Great. Awesome. So again, I'm really glad to be here. I had asked Amanda if we could do a poll to start. So I think you guys have to do that on your end just to find out who is here. So whether you're, oh, look at that. Great. A peer, a parent, caregiver, healthcare provider. So I would love to just have folks, you can just click right on there. And we should be able to see sort of who is here with us today. And then once we see that, we can certainly, you know, try to aim things towards that a bit. Give people a few more seconds. So you can just click right on there. So it looks like most people are mental health providers, but we do have some teachers who are probably here taking a break from their very difficult jobs they have this year. Awesome. So thank you, Amanda. I'm gonna look at that. We can share results. This is just so much fun. So it looks like mental health providers are largely who's here with us. And so, you know, today my goal is, whoops, Can I get out of this poll somehow? Oh, there we go. Today, my goal is really to talk a little bit about talking to our kids about current events. And, you know, when I started to write this presentation, I was really focused on COVID, but I think we'd be remiss if we didn't try to talk about some of these other issues that are going on as well, because they all really interplay. And I think if we're going to talk to kids about these things, we have to be honest with ourselves that there's a big overlap in a lot of these issues. So not just COVID as a pandemic, but how it affects school, some of the racial injustice that's been happening in our country, and really everything else in between. So we can go to the next slide here. So I want to talk a little bit first just about generally approaching conversations with kids, and then we'll move on to talk about some of the more specific things. I also let Amanda know that I am happy to take questions. I think they want you to put those questions in the chat, if I'm not mistaken, and they can kind of throw them to me as they come up. But also, you know, I want people to know that my general style is that if you have a question and it's pertinent to what I'm talking about right now, feel free to put it in the chat, and either Amanda will let me know, or if I see it, I'll answer it. I would prefer always for us to be more interactive than not. So we can go to the next slide. So one of the main things I've been asked a lot lately is, how do we talk to our kids in general? And one of the things that I just think is so incredibly important is our job as adults, whether that's a mental health provider, whether that is as a parent, a teacher, is really to be curious. One of the things that I think are one of the flaws that we often do is, as adults, and all of us, including me as a child psychologist, are that we sometimes do this thing where we assume we know what kids think and feel. But your first thing should always be to ask your kids what they know and what questions they have for you. It's a really valuable tool to teach your kids that you're interested in what they think. And it's even more valuable that you're not pressing on them what they should feel. Overall, I like to say, keep it brief but honest. And that goes for everything. So, you know, I took my 2 little kids to get a flu shot this morning, and one of them said, "Is it going to hurt?" And I said, "Yeah, probably, but just for a minute." That's all it takes, right? We need to be honest with our kids, because if we can be honest, we're telling them your conversations and questions to us matter and we care. We need to empathize with our kids. So, you know, things might be hard sometimes, and that is okay. Another thing that I think overall is important is just talk about what kids can do, right? So I want you to think about, as I talk about all these different pieces, how approaching these conversations kind of go in, and then keeping that conversation going. So one of the things that is incredibly important, whether it's COVID or racism or school, is that you can't just have a conversation once and then be done with it. It's really important we keep these going in an ongoing manner. So we can go to the next slide. So, you know, I made this, I don't know what we call it, graphic of a tsunami, because I think what I Googled was tsunami plus hurricane. So we have this perfect storm of pandemics on mental health, right? And I think it's incredibly important to address this. I also think it's important to say, I picked a tsunami for a reason, right? It kind of comes in really quickly, it destroys a lot, and then it goes back out and people rebuild. And so I like to think about this in the same way, that yes, the pandemic might be overwhelming, but also we can become resilient and help our kids become resilient. So what is the perfect storm of pandemics on mental health? Pandemics, both COVID and when I think about things like the racial injustice in our country, can cause a lot of things that are really difficult. One is our lack of purpose. So when we think about things that sustain mental health difficulties, lack of purpose or not feeling like you have a direction is a big one. When we're stuck at home, when people are losing jobs, when kids are not going to school or playing sports, they kind of start to think, well, what is my purpose? What am I doing here? So social isolation is huge, right? We know that from a clinical perspective, one of the first things we tell people who are experiencing anxiety or depression to do is to get out and do something social. Can't do that during COVID-19 and couldn't certainly do it in the first few months of it. Lack of sense of time. I don't know about all of you, but I have kids. And for that first 2 months, I think bedtime went out the window. I didn't know what time we were waking up. We were missing lunch. It really can cause disruption. Inability to engage in our pleasant activities, right? So we couldn't necessarily hang out with friends. Our kids couldn't necessarily play soccer. And some of this is shifting, which I'll actually talk about, but really important to think about that. One of the hardest pieces, and why I put it at the middle of this sort of wave, is this concept of negative or irrational thoughts actually coming true, right? So instead of being able to say to our kids, no, 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 that will never happen, especially for our anxious kids, we're having to say, yeah, those things sometimes are happening and they can be scary. And then the worst part of the human condition, the great unknown, right? So when people don't know what's happening next, they become extremely stressed. These things sort of create this perfect storm for mental health difficulties during this time. Next slide. So I talked about a lot of this, but I think, I want you to also think as we work through this about pediatric and adult mental health, and how we can deal with some of this stuff, right? So social interaction versus isolation, finding different ways perhaps to have some of that social interaction, making sure that you are being a little bit creative, right? So we can't maybe do the same things we used to do, but can you sit outside with friends? Things like daily schedules, and I'll talk a little bit about that more on my next slide, but even things like setting alarms, set timers to do tasks, make a list of activities that you could do or that you plan to do. And then we're going to talk about some of these a little bit more in coping later, but things like challenging your thoughts. And then I always say, and I know Annie mentioned this in the beginning about, not being afraid to get help, but I'll mention it now. I will mention it again during coping skills. It is so important that if you feel overwhelmed or your kids feel overwhelmed, that you're open to engaging in that. We can go to the next slide. So what can we do today? I mentioned some of these, but schedules and routines are really important to kids. There is some research that says that the thing that helps kids be most regulated around sleep is a consistent bedtime. And you'll note that I did not say an early bedtime, because actually what the research says is anytime before 9:30 for school-aged kids, and it gets older as kids get older, but consistent bedtimes are incredibly important. Meal schedules, right? So I mentioned, skipping lunch, but making sure that your kids are, just because they're home, if they are home with virtual learning, doesn't mean that they can't have some meals at the same time they would normally. Hygiene. If you're a mental health provider or parent of a teen, this is probably a big one for you. It is monumentally difficult to get teens and older kids to go take a shower when they're in their pajamas and they're not going anywhere. Hygiene, brushing teeth, taking showers, flexible schedules, right? So we talk a little bit about this, but even things that you guys might say, okay, today you have to get these 3 things done. It doesn't matter what time, but there's some amount of schedule to doing it. One of the things that I think is important also is these social check-ins. So I think one of the things that's kind of difficult is that thing that I think has become even more difficult is COVID's continued to shift. So in the beginning, when I was giving these talks, I was like, we're going to wear a mask and we're going to get through it and it's going to be fine. And I think we've really seen this disease progression. So what we've seen is we've learned some really great things. We've learned social distancing and masks work, right? But we've also learned that COVID is not going away in the way that I think a lot of us thought it would, right? This pandemic that would pass quickly. We've also learned that, while we hope there's a vaccine, that might not be the cure-all. And so it's important to give yourself permission to shift in how you feel over time. And you need to give your kids that permission too. They might feel really great one day and really cranky about things another day. A really important piece is talking about your family's level of comfort. This is a question I get from parents all the time. What do I do when my kids are really into following the rules, staying home, doing what they have to do, but my neighbors are letting their kids do whatever they want, right? So that upfront conversation with your kids is really, really important. And then talking about health behaviors, right? So when I talk to kids or teens, even in practice, when I talk about health behaviors like mask wearing, distancing, washing hands, I talk about them as helping behaviors. Why? Well, one, because teenagers don't really care if you say do this because I said so. But 2 is we talked about that loss of purpose, loss of sense of like being needed. This is a way to give kids that and to give some control. If you can say to your kids, you know what? We wear masks because we want to be a part of the solution to this pandemic. That goes over far better than put your mask on because I told you to, which admittedly, some of us probably all say sometimes too. And then practice those behaviors. Don't expect that your kid, especially if you're someone who either works with little kids or has little kids, Don't expect that kids can just put on that mask and go outside right away and be fine. Some can, but practice it. Leave masks around your house. Practice that hand washing. Play a song they like. Anything that you can do that you think is somewhere in that realm is incredibly important. And the other thing that I like here is I think it makes kids feel confident. So my kids, for example, we have practiced mask wearing since March, and my kids will go out and say things like, I'm so excited to wear a mask because I'm keeping people safe. Now, does it wear off sometimes? Sure, but it's a good way to get them to feel like they're part of the solution. Next slide. So the other things that I think are really important here, and again, we go back to that being curious, right? Have a family meeting, and you might need to have these more than once, because what might happen is the disease might shift. And it might shift again, and your kids might be in daycare or school right now, and then suddenly they can't be anymore. And that is just so tough for kids. You as mental health providers, as families, can really recommend these things, right? So if you're a mental health provider out there and you're working with families, you can say to a family, it sounds like things are stressful in your house. Have you had a family meeting? Having parents ask kids like, what's going on? What are the good things? What are the bad things? What are your stressors? What are your expectations? There is nothing more helpful to children than knowing what comes next, besides their parents being really consistent and loving. And so you can do that in a family meeting. We care about you. We want to make sure everyone's doing okay, but this is hard, and we know it's hard. The other thing is that as this sort of shifts on, right? We're on month 7, 8. I don't know what month we're on anymore. I think I've lost track. But to think about what losses have kids had. So if you're a mental health provider, making sure you're asking that question. Has there been anything really difficult for you in the last 8 months? Has there been anything you really missed, or have there been any big changes? I think what I've realized being a clinician is what seems really little to us can be really big to kids. And I do not like to go all the way to the extreme of, oh my gosh, my kid can't play a sport, they're going to be depressed. Instead, I like to think about it as, this is a loss, and how can we talk about it? Let's be consistent. Let's talk about the fact that we understand this is hard. Let's go back to that empathy building, right? I'm so sorry you're missing your prom this year. I'm so sorry you can't have the play date with the kid who perhaps is not following the rules, right? I'm sorry for those things. It really is a struggle for me too. I really understand why this is so hard for you. And I want to make sure we're being thoughtful about it, right? Check in at least once a month as things change. Again, I think this is one of the big pieces of this conversation. And then be curious, right? Keep those conversations going. Your kids might have questions, today that they didn't have yesterday. And, I think both as a pediatric psychologist and a mom, I'm hearing so many of these questions pop up. And, my patients are asking questions like, do you think this will ever go away? And will my depression get better if it goes away? And so we have to talk about some of those things. And for little kids, they are curious about, when can I play with my friends again? Or when can I go back to daycare? So answering, being curious, and keeping that open. Next slide. So school has been a really hot topic, and I just want to spend some time addressing it, because I think as mental health providers, this is becoming more and more and more important, right? So school, I suspect, and I don't have any inside info, so don't say that I do, but I suspect will keep changing this year. I suspect that some schools will go in person, some schools will be out. I think there is currently a pretty obvious disparity and divide between private and public schools, which is really difficult for a lot of us who are mental health providers, knowing that some of our kids that we see perhaps in therapy are not getting the same benefits that some other kids are. But the thing that I think is probably the number one piece of advice I've given to parents and mental health professionals in talking about families is really help adults process the information school's giving them before they talk to their kids, right? As adults, we have, maybe not all of, but a little bit of the capacity here to sort of talk about why this might be difficult for us, and then to bring it to our kids. And I'll talk a little bit about modeling that behavior, but that's really important. Giving small pieces of honest information is also important. So if your kid says to you, am I going back to school? And you truly don't know, it is okay to say, I'm really not sure. I hope so. Your school's plan says maybe in November, but I'm just not sure yet. That is all right. It's also okay to say things like, I'm kind of frustrated because I don't know. It's all right to let kids see that emotions are normal. It's okay for them to be upset. Once you give your kids information, let's say school's changing, they're going to go hybrid. Give them that information and then be able to sit quietly. It is one of the hardest things of parenting, but we need to be able to do that. It is one of the hardest things of being a mental health professional, but we need to be able to do that. And then wait and ask, are there questions you have? How can I help you? Be honest if you still don't know the answer. But you can also do things like talk about what you're excited about this year. So I, think about a lot of the kids I work with, and I talk to them even now, like, what are the upsides of virtual? What are the upsides of in-person if you're in person? It doesn't have to be a big thing, right? The way that we help kids reframe how they feel about things is to reframe how they think about things. And the example I gave about this that I think is, a good and kind of funny one this year is I asked a teenager this question and she said, oh, no one's ever asked me what I'm excited about for this year. Everyone just tells me it's going to be terrible. I said, okay, tell me something you're excited about. And she said, honestly, I really hate the food in school and I'm just going to make my own lunches. And it was a small thing, right? But it was enough to get her down the path of talking about some of the positive. And my goal is not that kids are going to leave the conversation about school this year all happy and think it's all great. My goal is that kids are going to be flexible in their thinking, just like we want ourselves to be as mental health providers, as parents. And then ask, do they want to talk more about how you feel, right? At that point, they might say, I'm good, this is fine. But I think that this is giving them that opportunity is important, because otherwise what we're doing is basically saying, too bad, move on, deal with it. Okay, next slide. So one of the conversations I've had with a lot of families is about, as we continue to walk down this path of what does school look like, having that discussion of virtual versus in person. I know right now in Delaware, at least 4 or 5 school districts are working on their hybrid plans, right? And what that looks like. So a lot of parents are saying to me, well, how do I make that decision, right? And I think it's important, especially as your kids get older, to have some of those discussions with them. If you have a first grader, you're making the decision as a parent and you're going to talk to them about it. But if you have a teenager, talking about what that looks like, hey, if you choose to stay virtual, here's what the program looks like. If you choose to go in person, here's what I suspect it will look like. Again, you might not have those answers, but just talking about those things is so important. I also think that when we're talking about COVID in school, we have to talk about what it looks like and what it might look like later in the year. Again, this goes back to preparing our kids. But when I think about this, one of the things that I think you can do that's really tangible is actually like take down a piece of paper and start writing, right? What does virtual look like? What are the things you'll have to do? What does in person look like? What are the things you'll have to do? And have a really good discussion on the tangible details, because again, that gives that sense of control. So one of the examples I give for this is I had a family I was working with and the kid was going back in person and the mom said to me, she's really excited. And I asked the kid and she was probably like 10. And she said, no, I'm not really excited. And I asked her why. And she said, because I don't know what school means. And so the mom hadn't realized that, right? And so she hadn't realized that they'd talked about going back, but they didn't really talk about the details. So tangible details, right? So for a family like that, talking about, how are you getting to school? Is someone driving you? Are you taking the bus? Do we have to mask? And when do we have to mask? Do we have to bring our own lunch this year? Do we have to stay distant from our friends? Or are there some rules about being allowed to play on the playgrounds for the younger kids, right? For virtual, I want the same things to be happening. And I also want to say, I wrote this down later in the slide. You can do this still now, but you can do any of these things now with the families you're working with or your own families. Talking about what in virtual looks like, right? So, hey, you're going to sign on at 9 a.m. At 10:30, you have a break. Here are the snacks we have that you can have during break. So really focusing on those tangible details. And then pick a few things to actually do to prepare. And again, you can still do this. Last week, I had a patient who was feeling really bummed about school, a teenager, and I asked what she could do to help her feel a little bit more excited. And she was like, I think I need to like go buy myself a water bottle to put on my desk. It was a small thing, right? But she did it that weekend and she brought it to her virtual school that next week and she felt better. And then being realistic that you need to be flexible. This is incredibly important. I don't like to give any impression to any of these kids that this is, the way that this is going to be forever, or that this might be the way it's going to be for even a month, because we don't know. So being really honest, asking those questions again is really, really important. So as I was thinking about COVID and schools, I thought that I would be remiss to not spend a little bit of time also talking about what's going on in terms of racial injustice in our country, because there's no way to separate all of these things. And we have two pandemics that are colliding and clashing, and ignoring the sort of racial injustice and, on the flip side, anti-racism efforts that are happening, I think is doing our kids, one, a disservice, but two, it's also not being realistic about why some of these things are so hard this year. So we can go to the next slide. So I'll tell this story that I think helps to also point out the fact that this is an ongoing issue, right? I work in a clinic where I have a lot of Black families I work with. And I thought I was being a really good psychologist by, after the George Floyd death, asking one of my teenage patients how he was doing. It was the week that Wilmington had a ton of protests and a little bit of damage. And he said to me, "Dr. Walls, do you know that racism isn't new?" So now my title slide for all of these is "Racism Isn't New." He is a 16-year-old Black boy, but looks like a man, living in America. And we talk in my clinic about the interaction between racism and COVID and these things. And it's just so important, because your kids are going to ask. If your kids are in school, they are hearing this. If your kids are in virtual school, they are hearing this. One of my colleagues last week got an email from a teacher that her daughter had brought up anti-racism. So if you think that kids aren't hearing about this, you're wrong. And we need to figure out how to address it as adults. So not new, certainly, but has been newly examined and discussed in the aftermath of a lot of racial injustice. And I think that our kids are seeing this on the news, hearing adults talking about it, but also hearing their friends talk about it. COVID-19 has also sort of laid bare these health disparities, right? So when we think about who's getting sick from COVID, who is dying, it is more Black and Hispanic Americans than white Americans. It is more lower income Americans. And so the other thing that kids are picking up on is the difference in decisions families are making based on these risk factors. It's imperative that we talk to kids about race. If we're going to say this is current events and pandemics, this is part of it. The number one thing that I talk to parents about lately is this concept of color blindness. So a lot of parents mean really well. A lot of mental health providers mean really well. And we say things to young kids like, everybody's the same, treat everybody the same. The problem with teaching kids color blindness is that if we can't see the differences, we can't see when the differences are causing mistreatment of people. And that is a really simple way to describe it to kids, right? And I talk about stick to the basics in science for young kids. You can have conversations with your patient families, with your own kids, with your students that are really basic, right? Let's talk about differences overall. Let's talk about noticing differences and celebrating them versus trying to sort of downplay them. Kids ask lots of questions. So again, back to my curiosity point, right? I've talked to both my patients and my own children about, what in our bodies causes different color skin, and why that doesn't really mean much, right? Except for that's what it exists. But that it does have a history that comes with it. The other thing that I just think is so incredibly important here, and I'll talk a little bit about diversity in general, but my favorite piece of research is this. Babies already have biases for people of the same race as them. So if you have a baby who's under a year old and you are a white family, your baby is going to choose to look at, play with other white people more. If you are a Black family, your baby who is Black is going to choose to look and to want to be with people who look like them more. It's just part of humanity, right? It's familiar. These biases continue over the first 5 to 6 years of kids' lives. When kids hit between the ages of 5 and 7, there is some hard research to suggest if they have friends and interactions with children who are other races than them, it almost erases all of those biases. So when I think about this, it is one of the coolest pieces of research. And I think, all right, well, you know what? We are going to make sure that we give that information out, because I don't think parents think about that, right? We don't think about how do we best set up our kids for things like not having those biases. And that's one of the really easy ones to do. We can go to the next slide. So besides doing that, what can we do? First thing, which is my theme here, right? Let's just ask our kids what they've heard. If you are a mental health provider and you are treating kids, especially Black and brown kids, and you are not asking about race and how they are being treated and what they are hearing, we are not doing our jobs. And that's a pretty hard stop for me. We are just not. You cannot treat someone's struggles, you cannot treat someone's mental health without understanding some of the triggers or the experiences they have. I am incredibly clear with my patients that feeling distress over racism is not on them and it is not their fault, and that it is society's fault, but that it's okay to feel that way and to feel sad, anxious, depressed about it. It's nothing they've done. It's nothing they probably could have done differently, but that we want to be supportive and that we want to believe that we can make a difference, right? So how do we do that? We ask them how they feel. We ask them what they've heard. And for our own kids, we ask them those same questions. And the responsibility is on families of all races, right? We don't want this to be just a Black family thing or just a white family thing. Black families spend far more time having to talk about racism with their kids than white families do. And we really need to flip that script. Even with our young kids, right? So talking about things like the history of racism, talking about things like easy stories to tell them, right? Did you know that it used to be that Black kids couldn't drink out of the same water fountain as white kids, and that was only because of their skin color? It's okay to have those conversations, and your teens are hearing so much. So your teens, is probably even more important to talk about those things. With our kids, we also know that exposing our kids to diverse toys, books, stories, and experiences are important. And when I think about that, I don't want kids just exposed, though it's important, right, to stories of Black history, but also just diverse books, the characters, right? And I think about, I don't know if any of you have seen this or heard this, but there's somewhere a meme that or a story that this little girl who was Black watched Doc McStuffins, and when she went to the doctor, there was a white male physician, and she said, well, where's the doctor? And I just love that story, because what we expose our kids to is just incredibly important. What else can we do? We can model anti-racist behavior in our home. So when we hear things that we think are wrong, we can speak out. We can do the same thing in our workplaces. We can do the same thing in our therapy sessions. We need to also remember that anti-racism is not political, and that we're not asking people to be liberal or conservative. We're just talking about how we treat other humans. And we need to also be aware that different kids have different different situations. And I see this comment that I want to address in the chat that says, I work with teens. I encourage them to join in marches and speak how they feel, but they are afraid someone will try to hurt them. I fear someone might try to hurt them. And so my conversation with families is always, what does your family feel? What is your perspective? And how can we help you to put forth what you believe in a way that feels safe for you? So I have those conversations with families, not just the kids. And then leaving the conversations open and encouraging your kids and teens to ask questions again. So, if you take nothing else from today, take that we're going to ask our kids a bazillion questions. We're going to ask our patients a bazillion questions, and we're going to listen to the answer. If you ask a question and are already on to what your next thought is, especially with teens, you lose them. You need to get their buy-in. You need to make sure that they're with you and they hear you. I do not pretend that a few slides about that issue is enough, but I think it's important that if we're going to talk about current events, we at least touch on it. So I'm happy to talk more about that towards the end or with questions, but wanted to just address that we sort of have these two pandemics, one of which is not new, but I think is important as we talk about how do we talk to our kids about these things. Next slide. So coping with stress and current events. Parents and adults, one of the first things I talk about is self-care. And I jokingly say it's not just baths and walks, because I feel like we see all those nice ads right on Instagram. It's like, you could take a walk or take a bath. But self-care to me is, what can I do to help myself when I'm feeling overwhelmed? And that can be a number of different things. It can be talking to friends. It can be going on a walk or a run. But I don't want people to think like, oh, self-care is just that word we use. I think we need to actually be, as mental health providers, really adamant that everybody engages in self-care, that we take breaks, and that we make sure that we're encouraging other adults to do so as well. Normalize feelings for your kids. One of the things that I hear most in clinical settings is, a kid is upset or nervous or even kind of depressed, and a parent is like, you have no reason to feel that way. You're going to be fine. And that is just not helpful. We need to normalize feelings. You as an adult and as a mental health provider, as a parent, as a teacher, are allowed to have feelings. So let's tell our kids they're allowed to have them too. Let them be sad. Let them be, ready to have that conversation with you, because later on, if they feel more sad or more anxious, they're going to come back. Offer to them, hey, if you don't want to talk about it today, let's talk about it another day. I am here. For our teens and our older kids, offer to have those conversations via text or through a note if easier than face-to-face. I never thought I'd say this, but I think some of my greatest family therapy successes is of teens who refuse to talk to their parents because it feels weird, but will send mom a text, or will write dad a note, or will call grandma on the phone. But that conversation face-to-face is really hard. So every once in a while, technology is helpful. And then model what, this is the biggest thing for me, not just let feelings be okay, but model that we can be upset or we can be okay. So we can go to the next slide. So for me, I always put this slide if I can, because I actually think this is one of our most important lessons. We can talk to our kids all we want. We can say the right words. We can sort of, most of the time do the right thing. And we also might mess up sometimes, and that's okay. But I love these pictures because what I think this reminds me of is that our kids are always watching, and that as mental health professionals, our patients are always watching. And one of the most important things you can do for families is to talk to them about this. I also purposely include that picture on the lower, well, it's my lower left, I'm not sure if it's mirrored for you guys, with the mom sort of sad and the kid laying on her. Because here's the thing. Modeling good coping doesn't always mean sunshine and butterflies and smiling. Sometimes modeling good coping means I'm going to cry because I'm sad, and then I'm going to get up and make dinner and keep going, right? Or I'm going to cry when I'm sad, and then I'm going to seek out treatment because this is really hard. But when we look at those top pictures, this is what I see happen in families most of the time, is kid gets upset, mom gets upset, they start yelling, and it goes in this circle. And this goes for coping, but this also goes for things like why I'm saying to address school yourself on your own terms before you talk to your kids. Why I think it's important to read and learn about racism before you talk to your kids about it, right? Because when we show kids that screaming and yelling and throwing a tantrum when we're upset about something is the way to handle things, that's what they learn. And that does two things. One is it teaches them to have a relatively negative style of coping, right? So we're screaming, we're yelling, we don't get our own way. But the second thing is, what I'm seeing happening during COVID is people throwing tantrums about things that they shouldn't, right? Whether that's wearing a mask or going back to school. And at some points, those people are getting some people to give in. And what does that say to kids? That says if you throw a tantrum and you're loud enough, you're going to get your way. That is not what we want to teach our kids. What we want to teach our kids is you're allowed to feel like those people on the top screen, and you can even act like those people on the top of that screen sometimes. But we also need to figure out what else to do. So I think, these are just very difficult times, and we want to make sure that we are being cognizant and thoughtful about adults' feelings, but also that we're modeling good things for our kids. We can go to the next slide. So I'm going to go through a few of these things. I want to also make sure we save at least 10 minutes or so if folks have questions. But I think the other sort of pieces of this are, we need to continue to encourage positive coping. There is absolutely no shame in needing more help. Again, I'll refer back to what Annie said in the beginning about we want to make sure families are healthy and that people can get help. You are not alone. To give you all an overview, I'm not sure who's been, listening to some of the other NAMI conference pieces. I've only been able to pop in and out, unfortunately, this year, which is one of the worst parts of virtual conferences. People schedule you for other things. But I'm not sure how much has been talked about. The mental health issues that are happening during COVID are really understandable. And part of it's because of that perfect storm I talked about. But there is about 1/3 of adults in America right now who are saying that they have some significant anxiety and depression symptoms. It's a pretty big number. In kids, we don't know that number yet. But what we do know is that COVID acts almost like a trauma for some kids. What do we know about trauma? We know the same event can happen to lots of kids and only some will have a negative reaction. So when I think about coping, what I think about is, okay, some kids are going to be okay. Some kids are going to need more help. Same for adults. Some kids are going to be able to read a book, go on a run, feel okay. Other kids are going to need treatment. So please do not be afraid of, encouraging your patients to stick with you more frequent sessions. If you're a teacher out there, keeping an eye on your students and referring them if you feel like that you need to. A lot of folks are doing telehealth right now in Delaware. I think every pediatric provider I know is doing telehealth. We're trying to get kids in if they need to, but making sure that we also have that option. But then I also listed some other things on here that I think are just really good to note and to do. So diaphragmatic or belly breathing is one of my favorite tools. I had a 6-year-old patient in my office last week who felt really nervous, and we spent 10 minutes doing some slow, low belly breathing, and she felt better. That was a 10-minute intervention, right? And her mom could do it at home with her. Progressive muscle relaxation is something that I think is really wonderful, especially for kids and adults who are having a lot of the stress held in their bodies, right? So there are great videos on these things. You can download the Calm app. There is an app called Belly Bio that is actually a belly breathing app. That's great. And then guided imagery also kind of fits into that category. So what can we do? What are active coping skills we can do? I really encourage folks to not only use these, but to think about how not only use them with your patients and your own kids or your students, but also to use them yourselves. There is nothing that I like better than guided imagery with my 8-year-old before she goes to bed, because it's the best 15 quiet minutes of my day. So also, as mental health providers, I think it's important that we note that there's a kind of a high burnout amongst us right now, and that we need to make sure we're doing these things too. But it's also okay to have other coping skills. So things like art, music, writing, exercise, those are all great. And we want to encourage kids to do that. That is something that, I think is really important that we can do. And then the last thing that I think is really important here is other social coping skills. So be kind of creative, think about what we can do to get our kids out. So every family is different. But what we've learned about COVID and what we've learned about some of the things that are going on with racial injustice is that we know having social interactions helps. So if you have older kids you're working with, making sure that you are, setting up maybe an outside time they can have, sit in the driveway and talk, or at a park with the younger kids where they can be distanced. Kids are super, super good at adjusting to what they need to do to have social interaction. So some families might say to you when you're their provider, like, my kid won't do that, they won't wear a mask. But I have been incredibly impressed with children and teenagers following these rules and doing what they can. So I'm going to stop there and go to questions. I see Bryn's question in the comment, which I will answer. Can you tell us more about the guided imagery before bed? I love this idea as a parent. So guided imagery, for those of you who perhaps haven't participated in it or don't know, generally what it is this concept of listening to a script that's almost like a meditation script. But for kids, the ones that I love talk about perhaps a walk on the beach, or you're floating on a cloud. If you Google kids guided imagery script, there's a couple that are incredibly good. We ask Alexa to play them at night, and she does, and it's great. And I suspect that there are going to be times when kids are really stressed, and this can really help calm them down. I have one kid at home, and I'll be, transparent here. I have one kid at whom who's doing great. She could care less about the pandemic. We have her two little friends in kindergarten are in her class in our neighborhood, so she can play outside with them. She is not worried about COVID. She is not worried about anything. And then I have my older one, who is my kid who tends to be more nervous. And so we do actually work on a lot of these things. And I'll tell you that teaching these kids these things young are so cool, because they are going to become adults who know how to cope and who have these coping skills. And my 8-year-old said to me last night, my anxiety is causing my tummy to feel nervous. I'm just going to tell it that it's just because I'm anxious about my flu shot and it will be okay. And she talked to herself through it. And so the more we kind of tell our kids these things, the better off they're going to be. So we can go to that last slide there. And I'm happy to take other questions, comments. My contact info is there. Bryn also commented here, thinking this could be really helpful as a preventive measure too. I do it for myself, but never thought to do it with my son. Yeah, so I love all of these tools. I think of coping skills as teaching kids tools versus just dealing with a problem. So I really love this concept of tools and making sure that we are interactive with our patients and our own children and students in a way that's really helpful. I see one other question in the comment here, and then we can open for others. People are welcome to chat, or I don't know if Amanda, if they can raise their hand. I don't know what happens next. But the other question I saw in here pretty early on is, do you believe that we are born with a fear of the unknown, and that is why babies have biases? So, I think this is a little bit of a complicated question, but we do know that kids in general fear what they don't know more. So the more we expose our kids to differences in people, but also like environment situations, the earlier, the more flexible they tend to become. I think, that question reminds me that this, for as providers, as parents, as teachers, that conversation can start really early. So, or that, I guess, effort can start really early, right? So the more we expose our children and that we encourage families to expose their children to more diverse situations, people, books, toys, the earlier, the less our kids have that fear, because they're actually being sort of shown from a very early age that differences are okay. Other questions? There's Amanda. Hi, Amanda.
Hi. Yeah, well, thank you so much. I did get one question in a private chat that I think would be helpful for you to address. Someone asked, how do we handle what children are seeing on social media and in this age of where there's misinformation, and how do you suggest, handling that?
That's a great question. Whoever asked that, thank you, because I used to have a line about that on my slides, but apparently, I don't know, I lost them along the way. So I have a couple different thoughts. One is, I think it's incredibly important to manage our children's social media. I am not anti-social media. I probably will never be anti-social media. Annie, who's on here, can tell you I use social media for work. I use it for spreading good information. And I want kids and parents to figure out how to do that too. So first, I want families to have media contracts with their kids. I do not care if your kid is 7 or 15, if they have a tablet, if they have a Chromebook for school, there should be a discussion about what that looks like in your house. Number 2 is talk to your kids during that about the fact that social media is not managed by any professional that is going to make sure they get the right information. And when you have those open conversations that I was talking about, right, your kids are going to come to you. Hey, I'm not sure that this thing I saw on Instagram was real. Can you check it out? We want to really, really work preventatively on having our kids come to us about those questions. The other thing is that I have found one of the best ways to manage your kids' social media is by downloading apps, right? So there's an app called Screen Time. You can manage exactly what apps they can go on and for how long. And again, I'm not anti-social media, but for our teenagers, you know, there is a connection from, there was an article last year published about like Facebook depression, right? And there is a correlation, not causation, but there is a correlation between time spent on social media and some of these anxiety, depression symptoms. So, you know, I think we need to be cognizant of that and to manage our kids' time. But with these apps, the nice thing is your kid spends an hour on Instagram for the day and it just shuts it off. There's no argument. And so I think that's really important. And then the last thing I'll say about this is, I think overall, we need to think about what our kids are exposed to. So, you know, I like to say if your kid is under tween teenage, I want them in your earshot if they are on any sort of media, YouTube, perusing your Instagram because it's fun to do filters, whatever they are on, earshot, eyeshot. For older kids, managing their phones or their tablets, you should know what they're on. I recognize teenagers can hide things from us, but if you have an upfront conversation, they're far less likely. And I think part of that conversation becomes, hey, not everything you see on the internet is real, right? Let's come and have a conversation about it.
Great, thank you. There was another question that came up that said, what advice would you give to first responders and their families in handling the added stress of these uncertain times?
Great question. So while I am not what I will call first responder, I've been in clinic along the way here. So I can say that there's been a lot of added stress, right? So I would say a couple things. One is I really encourage the first responder parents to make sure they're taking care of themselves. If you are in Delaware listening, the Hope Line, so the DSAM Hope Line actually has a specific path for first responders, physicians, those folks that they're making sure that they are getting both access, but also appropriate care. So talking to, you know, psychologists or behavioral health professionals who have some sort of medical background, right? So who can understand that. So number one is take care of yourselves. Take a break. If you get home and you feel really guilty because you haven't seen your kid all day, it's better to take 20 minutes, go take a hot shower and come back than just try to get through it. And then the other thing is I revert back to being honest with your kids. So how are we going to keep our house safe? How are we going to make sure that when I come home from work, I am, you know, doing the precautions I need to. And I think this is a hard path a little bit just because, you know, we spend so much time telling kids not to worry, right? Let's not over worry. Let's not over plan. But in this case, I actually think it's really okay. It's okay to say, I'm going to take off my shoes outside. I'm going to wash my clothes. And then the last thing I'll say is, you know, I think as mental health providers, teachers, parents, making sure we're acknowledging that this group of families still exists. I think when it was March, everyone loved healthcare providers, right? And I will tell you, no one's asking how we're doing anymore. And it's kind of become, you know, I think less intense, but for those kids and for those families whose mom is in the ED or whose dad is, you know, a police officer and can't just stay home, this can be an ongoing stress. So taking care of themselves. And then also if your kids are struggling, again, I really highly suggest it. I'll put in one more plug. Nemours has a program that is a 3-session coping with COVID program. I'm going to put the number for Nemours Behavioral Health in the chat. it is specifically was built actually for children of parents with first responders, but we've expanded it a bit and we get kids in really quickly, and it takes about a week and a half. We get through 3 sessions and we've seen a lot of great outcomes. So there are resources out there.
Great. Well, I think that's right up to about the end of our time. So I just want to take a second. Thank you so much, Dr. Walls, for taking time out of your day to present to everyone.
Absolutely.
A couple questions. That these presentations will be available on NAMI Delaware's website for 30 days after the conference ends on Friday. So if you want to review it again or send it to any friends, make sure to visit it there. Thank you again, and we hope everyone has a good rest of their day.
Thanks, Amanda, and thanks again to all of you at NAMI Delaware. I'm always more than happy to present at your conference.